All right, let's talk about dual sequential defibrillation. So right now, we do vector change. So after a few shocks, if the patient does not convert out of ventricular fibrillation, we'll put a pad anterior and posterior to hopefully hit that heart from a different angle, try to defibrillate different cardiac muscle tissue, and hopefully we'll hit the area that's causing the ventricular fibrillation. With dual sequential defibrillation, we're going to use 2 monitors, 2 sets of pads, both charged to their max energy. So this will be a pretty resource-intensive procedure, but fortunately it's not something we're going to use too often. But when we do use it, it can result in an increase in converting the ventricular fibrillation to a organized perfusing rhythm, and an increase in the number of patients that obtain ROSC and are discharged neurologically intact. So that's ultimately our goal, is to save those younger, not particularly younger, but patients who present with sudden cardiac arrest that are in ventricular fibrillation, that if we do everything, if we can just convert that incessant refractory rhythm, if we can convert that, we can save that person. So here's how it's going to look. We're going to set up our pads like we normally would. We're going to set the pads up in the anterolateral position. And just to make this work with these 2 monitors, I'm going to put this over this so that we can still defibrillate. So this one's going to go in the anterior position. It would be flat. And then this one's going to go in the lateral. Now, when I'm placing this lateral pad, I want to be very deliberate and specific about where I place it. Usually we place it too low. Do you think that if it's down here on the side or the abdomen, that when we defibrillate that the current is going through the heart? No, it's not. So I actually want it to be up really high. Think about the anterior axillary line where we stick a needle in. That's about where I want it. I want the current to flow directly through the heart. So I'm going to place this up here just like that. Hopefully you can visualize about where that should be, and we'll throw some pictures up on the screen so you can see what that looks like. Now we're also going to have the puck here while someone's doing CPR. So if I have defibrillated this person twice in the anterior lateral position, I'm thinking to myself, I need to perform dual sequential defibrillation. So hopefully I've got another truck, a supervisor on the scene, and I'm going to have them bring in their monitor if it's not already. I'm also going to get the Lucas because this is a patient, if I'm thinking 2 monitors, 2 pads, almost 400 joules of energy, I'm thinking this is someone that's an ECMO candidate. And since I have to roll them to place the Lucas backplate under them, I'm going to go ahead and place the posterior pad. But I'm going to do this very methodically in a controlled, organized fashion. So I'm going to brief my team on what I'm thinking and what the plan is. So imagine, just picture someone doing CPR here. We just delivered our 2nd shock. What I'm going to do is, hopefully by this point, the other monitor's here, I'm going to go ahead and start placing the other pads. So I'm going to place the anterior pad like so, just over, I'm almost midline in the middle of this, this cross here that's pictured on the accelerometer, almost in the middle. And then I'm just slightly offset on the anterior chest. So your heart is actually situated not perfectly in the middle, but the very mass of it, the mass of your left ventricle is slightly left of center. So that's what I'm trying to do when I place this pad. Now I'm not placing the posterior pad just yet. I'm waiting until after the 3rd shock. So I'm still shocking with my 1st monitor, and I'll go ahead and turn this on. I'm still shocking with my 1st monitor, and I will demonstrate this. So I've got my Lucas backplate ready, and I've got my pad ready to go. All right, so let's say that we have given our second shock. We're getting ready to deliver our third shock, okay? And if you look at our protocol, after the third shock is when I place the posterior pad. So I'm going to ask some people to help me. If I could have someone, Jacob, if you'd help roll the patient. And Houston, I'm going to ask you to slide the Lucas back plate under. So we're not ready yet. Let's imagine that someone's doing CPR, or actually let's picture Jacob doing CPR. He can also be the one that rolls. All right, you can stop. So we're at a minute 45. I'm going to pre-charge. I'm going to have this pad ready, and as soon as we roll, I'm going to place this pad, and Houston is going to place the back plate. So I'm going to say, stop CPR, clear VFib shocking, roll. And as we're doing so, I want someone looking at the monitor to see if the rhythms change. Keep them rolled. I would do this more fluidly, but I want to demonstrate that the rhythm is still ventricular fibrillation. I'll explain why that matters in a minute. So I'm placing this pad on the back quickly without talking, but I'm placing it just to the left of the spine and just inferior to the scapula. And then once that pad's placed, we roll them, and then we resume CPR. All right, so now I've got two sets of pads, two monitors. I'm going to turn the second monitor on. We can do our normal pit crew configuration, except this time I have to work both monitors. So if we're at a minute 45, I now charge both. Charge, 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 charge. We're at a minute 45. I've got someone on deck. I've got both monitors pre-charged. Now when I say switch and hover, VFib clear, I go boom, boom. About 1 second between the shocks. I'm not trying to push them both simultaneously, but I'm hitting them in quick succession. And as soon as we defibrillate with both, we resume CPR. And I've got the accelerometer connected to this monitor, so it is still giving us our feedback. And now I just have to figure out how to convey both monitors with the patient to the ambulance, because after this, I'm going to start packaging the patient and preparing for transport and activating ECMO if the patient's a candidate, because they meet criteria based on the rhythm, but there are also other criteria that has to be met, and I can throw that up on the screen as well. But that is dual sequential external defibrillation in a nutshell. It's going to go lateral, so come up a little bit, right there. You can bring it anterior more, just a little bit. There you go, like that. Okay, now this one, so this is the anterior pad. Actually, would you grab the puck and hold it up on his sternum to see where that would be? Okay, there. So we'd be doing CPR there, right? So I'm going to go right about here. And I've got that picture that would show you roughly where this is going to go, just like that. And of course, I can slide it down to make sure there's good adherence, which with him, I'm not going to do that too much. And would you mind turning around just a little bit? When we roll, you can see how I don't want to be on his spine here. I want to be slightly off center, off to the left, but you can see his scapula here. I don't want to be on the scapula because that's just going through the dense muscle tissue. So I'm going to be slightly off center, just a little bit, just below the scapula, so that I can get it slightly in between the scapula and the spine like this. And then that is, when all of the pads are placed, that's how we're going to place all of the pads.